introductions from the group. Would you like to go forward?
My name is Shelley Yankowski. I lost two boys to fentanyl poisoning overdose. And I represent the family member in this group. I've spoken all over the place, New England and everywhere about my boys and opioid use disorders. I'm also on a committee with a governor's committee where we look at the deaths that have happened, and we can either change legislation or write new legislation for rules and laws that might help in the future.
Great, welcome. Glad to have you. You, sir.
I'm Mark Hathaway. I'm representing the police department,
My name is Shelley.
and we appreciate the opportunity to be part of this group. Thank you.
Lost two boys.
Welcome.
Overdose. And
Me, my name is Scott Party, and I'm the founder of Fresh Start Sober Living, Fresh Start Inc. here in Bangor. We have 21 recovery homes in this area and 180 beds for people looking for recovery, safe and affordable recovery.
Awesome. Welcome. Jamie?
Hi, my name is Jamie Comstock. I'm the Health Promotion Manager at Bangor Public Health and Community Services. I oversee all of the chronic disease programs there. We work in substance use prevention, tobacco prevention, healthy eating, and active living. We do Narcan distribution, overdose prevention, and harm reduction out of our shop. I also, we coordinate the Bangor Overdose Response Team. And I am probably 4-year member at least of the Governor's Substance Use Disorder Services Commission.
Right. Welcome. Glad to have you.
My name is Jason Hunt. I work at Wabanaki Public Health and Wellness. I manage our syringe exchange program, our harm reduction team, 2 recovery homes, and a workforce recovery program. I grew up in Monson, Maine, and spent a lot of time here in Bangor, and am now living back here in Bangor.
Welcome.
My name is Scott Knowles. I'm a mental health and human services professional, but in essence, for this committee, I'm here because of my lived experience in long-term recovery from addiction.
Okay, welcome.
Carolyn Lear, I am Bangor's recent city manager.
And we also have on Zoom Lisa Williams. Oh, you're muted.
There we go. Better?
Oh,
You hear me
Maybe
now?
Our volume's down. Hold on, Lisa.
he turned it.
Okay.
down. Yeah, wait just one.
It's the TV remote. He turned the TV itself down.
With our powers combined, we'll get through this.
Takes a village.
Sorry.
Try again, Lisa.
Testing, testing.
Just kidding.
No,
Oh, he missed it.
let me go grab them.
Okay.
Let me first see if I can.
Lisa, can you hear us?
Yes.
Okay,
She can hear us, but we can't.
we're gonna try to get the David to come back in and undo what he did because it was making strange noises. So we can hear you. Don't really want to go ahead until she comes back because I know she's very interested in how this is gonna run and what's gonna happen.
I tried to work real fast.
Oh, listen.
Yeah.
Okay. We're gonna try that. David to come back in.
So we can't hear Miss Rogers, is that right?
Right. She can hear us, but. It's being recorded.
I presume it is.
Okay.
It
That's-
is being recorded.
I think we're hearing the YouTube play.
Yeah, that's
Up in
what.
the top right-hand corner, there's
Oh,
a thing that says YouTube. I don't know if you can switch that to. Host.
to host.
That's what's recording the YouTube and projecting it. I was told that you have to make sure YouTube is in the corner.
Okay, great.
Oh, for the recording, yes, okay.
But it sounds like the audio is coming through
Yeah.
computer speakers. So echo is the owl, correct?
Is the owl on?
It is on.
So perhaps try changing the audio to the echo speakerphone.
Both on the echo now.
Lisa, are you able to say something?
Can you hear me?
Oh,
Yes,
there
there
you
you
That's
are.
great.
Beautiful.
All right. Would you like to introduce yourself?
Sure. My name is Lisa Williams, and I am a woman in long-term recovery. I'm also the clinical director of residential services at Wellspring Treatment Center, and I am a board member of Bangor Recovery Network, and I am on the licensing board for alcohol and drug counselors in Maine.
Excellent. Welcome.
Thanks.
Did we get everybody now? Okay. And I'm not a voting member of this group. I'm Sioux Falls City Councilor, and I'm just gonna be chairing this wonderful advisory. All right, a little bit of overview. Each of you got one of these and you were sent some information. Essentially, that's just talking about our purpose as to why we were formed. And the best answer to that in a short statement is that we were formed as an advisory committee, a special committee to advise the city council on the best use of the city of Bangor's opioid settlement funds in a manner that is transparent, fair, and equitable. And I think if we keep that in mind as we move along, that will be helpful. And then, of course, we always have to look at the groups that we impact, from the citizens to separate groups for education purposes or whatever. So all of that has to be wrapped around what we come up with. There are 9 of you, and I think we've got a good opportunity here to really do some good things with that money. You've got a lot of decisions to make, topics to come up with, but I think we're all up for it, and so it should be a good committee. One thing I will ask, and I do this at all committee meetings, that everybody remains respectful, professional. I will allow everyone to speak that's on the committee. So I want you all to be heard, and we want everybody to hear what you're saying. Because you're gonna have to use all that information to decide what do we do next and where do we go from here. We definitely want everyone to participate, and we need to make a commitment to attend. We can't participate if we're not here, and it is very important work that you're about to do. So the respect and the spirit of cooperation, I think, is essential. And I pretty much facilitate the discussions once we get started. I won't stop anybody unless there is a I was asked if there was gonna be any arguing or anything like that. Well, we're not always gonna agree, but there's ways to disagree professionally. So if we keep that in mind, you know, we're all here for the same purpose. You all brought something big to the table that you're gonna have to, you know, speak out and let us know what your thoughts are. So one other question is meeting frequency. Are you as a group willing and able to meet twice a month? Through the end?
Typically, yes. I've got a thing coming up on the 10th where I'm gonna be out of commission for 2 weeks. Then after that, I'll be all set.
Okay. I don't want to get personal. Would you be able to remote in if we had a meeting when you're?
Probably, I just
when
wouldn't be
you're
able
out?
to talk.
Oh. Okay.
Yeah.
Well, you could listen.
I can listen, yeah. I'll type, my fingers will be good.
Okay, because if you're willing to do that.
Yeah.
David and I were talking earlier, and the next meeting would be July 9th. He's looking at putting him on the calendar for Wednesdays. Because that was the one we kind of landed on as a group to start with. And then it would just go, and he'll have all the dates on the city calendar for us.
What's the term for how long?
Through December, the end of December of this year.
Okay.
31st. As a matter of fact. And the other thing I was gonna ask you all to think about between now and next time is what are the top 3 proposals or ideas that you might have that you would like to see come to fruition through this committee? And that's strictly gonna be used as, for discussion and starting points of what we might be looking at as a group and where we might be headed. There'll certainly be more than that, I'm sure. 3 is just to get the ball rolling and get some conversation started.
I just got a message from Jenna Godo.
Yep.
And she said that she's logged in, but she's not showing up.
Oh, is she not in as a panelist, maybe?
Here she goes.
Wonder, hi Jenna. Now she's there. Just in time, yes. Jenna, would you like to tell us a little bit about yourself before you start your presentation?
Sure. Am I up next on the agenda?
Mm-hmm.
Okay, perfect. So I'm Jenna Godo. I'm the Outreach and Communications Coordinator for the Moss Center, which is the main opioid settlement support center. And I am the one of 2 initial people that is doing our kind of outreach to start with subdivisions when they're beginning their process or wherever they are in their process, and we connect. I have met with, I think it was your now a retired city manager. Prior to that, I had met with Jen Gunderman. So I've kind of connected a little bit with Bangor and where you had been those initial outreach or initial contacts. So now I am connecting with you all. Gathering of lovely. I heard all your introductions. I heard everything, but I couldn't do anything. So here I am. And this is so thank you for doing what you're doing for the community. So do you want me to go ahead and just keep going and share my screen?
Sure.
Okay, perfect. All right, so let me just get here.
If there are questions, do you prefer to take them as they come up or at the end?
I would say maybe at the end, just because sometimes I can't see you as well with when I share my screen. Sometimes then I just don't know if I'll necessarily, possibly. Let me just do my share.
Okay.
Can you see that?
Mhm.
Perfect. And thanks, Jason. I appreciate your help. I was like, who's do I sent Jamie message. You'll get a message from me too, Jamie. And I think I sent David one too. I don't know. I sent a few messages to try to like get me on. So thank you all so much for your help. So again, the Maine Opioid Settlement Support Center, we kind of came to fruition last July was the start of the contract with the AG's office. And I'll share that with you right now. Basically, though, let me back up real quickly. So we actually are part of the University of Maine system. So the Moss Center is a project of the SURE team, which is the Substance Use Research and Evaluation team at the Cutler Institute and under at University of Southern Maine. So we are the SURE team essentially is doing evaluation projects and partnering with people statewide, regionally, and nationally at different points for primarily any substance use and opioid specific, the rural opioid response, some of that work, and all doing evaluation and monitoring of a lot of these projects. So this Moss Center is an additional project of the SURE team. So just to give a little bit of background, and I know I don't want to take too much of your time, but I do have a few slides to get through. So if you need me to slow down, just kind of let me know. Slow down, Jenna. But I'm going to kind of move through. Essentially, if you're not familiar with, this is kind of the breakdown of the fund, the 30% to the direct share subdivisions, which is you all, and then the recovery fund, which is overseen by the Maine Recovery Council at 50%. And then the AG's office has the 20% portion. And we are funded within some of the AG's from some of their little pocket of the 20%. Not all 20%, a portion of that 20% of the AG's money is funding the Moss Center. So we are a nonpartisan, centralized just source of information and support to the subdivisions. And we will likely be supplying some support for evaluation to the Maine Recovery Council, but we're still working on some of the pieces of that and kind of what that's going to look like. We are a team of experts, kind of just like you all in your own capacities are your experts in this field and in this area. We have a lot of experience with community outreach and engagement. And in addition to what I had mentioned, that monitoring evaluation expertise. And we're really hoping that we, with our contacts and, people that we know and have contacts with statewide, that if there's any, we can leverage that support for this work. So the mission of the center is to really expand the capacity of Maine communities with and receiving the settlement funds to really implement and think about those data-driven, evidence-based strategies to address the epidemic through our consultation, resources, training, and other technical assistance. We aim to identify, deliver, disseminate, and support you all in this work. So the center was broken out when it was kind of conceptualized prior to me starting in my role into 3 core components. And those core components, the first of the 3 is outreach and communication, which is where I am the lead for. And the idea behind the outreach and communications for the funding is to really to promote transparency at the state and local level and to share information regarding the funds and what's happening in the state of Maine and via through subdivisions, and really think about and establish those communication channels to really help enhance any coordination that might need to happen or that we see could happen based on what we're learning about all the different subdivisions, and then also to really support statewide communication. And some of that is where we're starting, some different things are happening and we're building our ship as we're sailing, so to speak. So we're learning as we're going and seeing some ways or opportunities to really enhance the communication cross state or around the funds. The next of the three cores is community engagement, and that's really supporting the development of spending plans and the distribution of funds as needed or necessary. Really help to collect and make sense of community data and identify real-time and future needs of subdivisions. And then looking at best practices and lessons learned over time and what we've, learned and what we know already existing in this field. And then really to look and identify and facilitate any opportunities that we can help engage with partners. And obviously to provide any education and resources. And part of that is developing new resources, which we've been doing. And I'm going to share some of those with you later. And the other component is the monitoring and evaluation that I mentioned a couple times, really to promote that transparency for tracking and spending through public facing dashboards. We're in the stages of development of those dashboards currently, and we will be gathering that information and presenting that out in our website. So looking at like real-time quality improvement strategies for to inform programming. And then also what we've also been working with some subdivisions on is creating and track goals and tracking progress to assess the impact of the funding that's going out at the state and local level. So the meat of, and I think this is the more of the, I guess I would say fun stuff to talk about, are the things, the samples of work that we've been producing and providing to subdivisions. We've had a number of different TA requests, and when we have a TA request from a subdivision, we're trying to turn that around and make it useful for everyone. In addition, if it's something that can be applied to all subdivisions, and this is all stuff that is available to you all. So these are just 3 examples. We have the opioid settlement funds, a quick guide in the center. This was a subdivision that said, I don't really even understand what this money is and what's I don't even understand. Is this only, do we get this one time? And I said, oh no, there's a lot more to it than that. So we developed a quick guide to just share a little bit more about what this is, the intention of the spending, and just kind of to give a little bit more of a general overview. And the two examples on the sides are 2 of the 4 pillars of the recommended spending. And this is just a one for recovery and an example for the substance prevention, and just for education purposes and sharing with community members, or perhaps these were developed to educate commissioners. So it just depends on the topic. These are just 2 of the 4 for the pillars, for example. And because everyone is in a really different place that we've been engaging with, like some people would say, oh, we don't need that, but some people say, yeah, I really would like that. So it just varies by location and subdivision, what's helpful and what's useful. On the left here, you can see the policy template. We have one example. Here's a policy template that was developed for spending priorities and process explanation for, for example, the city of Bangor. I think you already have your ordinance from the city. So, but if pretend you didn't, then you could utilize something like this as a guide and input your information and say, this is how we're going to spend. This is our policy for how we're going to spend this money moving forward. This is an example and a template, and it can be, changed to make it work for whatever individual subdivision. For this in particular, on the right side is the opioid settlement fund process map. I think this actually might be something worth looking and sharing. I believe it was shared initially and sent previously, but this is something that we created. It's not overly printer friendly. The whole goal is that it's something that you read and look at electronically, but it's kind of a best practice look at how to approach spending the funds. And it has, within this, there are links to resources within the entire map, and whether it's a resource that's talking about the principles for creating a council, which you've already just done, and approach to which direction you might go. If you do this, then you might want to consider these things. So this is kind of like a map to go through in a best practice way to approach the spending. But obviously identifying needs is a little bit further down, but you also have to assess current capacity and look at needs, at the beginning as well. So there's different ways to utilize this map, but this is a resource that we found that has been really helpful to a lot of subdivisions. Couple others are spending plan development. We have here, this is a sample. We created the grant application template series that we have, and you can see here there's highlighted areas that are adaptable for your needs. And then we've created, for example, a scoring matrix that can help track and evaluate tools specific for a project or a position, and thinking about how you can look at spending those funds. So like you mentioned, if there are certain projects and you are accepting RFPs, this could be a template that's already created that you could tailor to the city of Bangor's needs and adjust as you wish, and then have your scoring rubric. And we can always make these, always adjust these to match up obviously with the application. And then we also can create online versions. We've had several of these that we also create an online version application. And it's a lot easier to collect, and instead of writing it down, you're marking it and having an electronic version to kind of do your criteria and grade them, so to speak, score them. So these are a couple examples of some spending plan development that we could offer. And then here's a couple examples of the tracking and monitoring support that we've been offering. So there's numerous communities that are hiring individuals who are either behavioral health liaisons, community outreach workers. We've had mental health liaisons, a lot of different names for a similar position. And this is one example of one of the forms that we're utilizing to just do easy tracking and looking at that data and having real-time data and analysis available for them in their role. And then this to the right is an evaluation report, for example, just kind of in general that what can be created after the fact with regard to during a project period, and just kind of creating a way to have those projects then report back to to you all. There's just a couple of examples, or a few examples of the work that we've been doing in the field, and there's other bodies of work that we've been offering to subdivisions as well. Those are just a few of them. So in summary, I would say that our primary goal is really to be supportive, but meet communities where they are. So if Bangor is in a place of, you know what, we don't know yet, we just really want to think about what options there are for how we could spend our money, then that's a way we can support you in figuring out what would work. I'm just giving an example. Or if you are already down the road and in a process of we want to spend the money through a grant process, and I really want an RFP template, etc., we can do that. So our goal is to meet you where you are and think about how we can make things easier for you with what I would say in general is that there's a limited capacity. Everyone's working other jobs. Oftentimes we have subdivisions that are really, this is just a tiny piece of, or it got dumped on their lap as, oh, wow, I don't even, this isn't what my expertise is in or whatever. So we just really want to help with that capacity piece. And think about how we can take some of the burden off you all and let us do like that behind the scenes work to make your product or make your process easier, if that makes sense. And I would say this is our first version of our website. The next one should be released soon, as I had mentioned. And so you can eventually soon, all those products will be on the website that anyone can go to at any time. And So this is where also we're down the road in a hopefully not too far future, we will have all of our dashboards, which we'll be reporting out on the Maine Recovery Council, ourselves as the center, the AG's office, and subdivisions. So we will have those dashboards will be covering the spending for all of these and projects and that for the state of Maine, to really highlight that transparency to communities. So this is just kind of the contacts for the leads for all the different sections, components and cores, and our director, Lindsay Smith. And of course, I have my email, people have my contacts, but we do have a center email, which is the mosscenter@maine.edu. So by all means, ask away questions and think about how we might be able to best help Bangor with your, help you with your capacity for the needs that you're going to identify through this process and your new committee. I know I went really fast, so I'll stop my share and answer any questions.
Great question. You said there was 4 pillars for suggested spending. What are those?
Prevention, harm reduction, treatment, and recovery.
Thank you.
Jenna, hi.
Hi.
I know that there are guidelines about what the funding can be spent on. Do you have that information that you could share with this group?
Yes, absolutely. Yep. I can send that to, I think I can send it out to whoever is, I'll send it out to, I'll get that to you. There's a couple different documents that I'll share with you all. Yes.
Thank you.
I had a question. I'm Shelley.
Hi, Shelley.
On one of the slides that you had there, it said funds will pay out until 2038. Is that, so if we were to come up with something, and then my biggest fear is we come up with something, but we can't sustain it year after year after year. Is that why that it goes till 2038, the funds?
The funds, that's basically, that's the lawsuit and the negotiations. Basically, that's a really good point. So thank you for bringing that up. That's one of the things. So that's not why necessarily, I don't think. I think it's because the money dwindles down. So I think that's one of the considerations for your group, and one of the things that we've talked a lot about when you're funding like big positions or, certain things, that you have to see if it's going to be sustainable over time, and the amount changes. I don't know if you have that projections for the city of Bangor, but that information is available. And you can look at, kind of where what's come in to date, and then how it comes in over the next 15 years, and how it spreads out, and how it tapers down to different amounts for every location. So some locations go down to very, very, very small amounts. Some of them are already receiving really small amounts. So that's actually one of the things that we think about, is how to have something that's sustainable and that can, build, I don't want to say in the long run, but be able to be either self-sustaining or, yeah.
Thank you.
But I'll send that along too, just to make sure, with that same document, and you can just forward the email out. I'll send the 2 things that Jamie asked for. And I'll send the 4 pillars as well, just those educational documents. And then I'll send the spreadsheets to make sure that you have all that information in one place. Sometimes it's easier to grab it in one email than a lot of places.
I was thinking maybe that flow chart also.
Yeah. Absolutely. Any other questions? Sorry if I was really fast. I was just trying to be
I think you did great.
Great, thank you.
I'm thankful you've done all this legwork. It's like anything we might need, you can help us with.
And if there's something that we haven't done yet, then that's something else we can do.
Yeah.
Our role is simply to try to support you to build your capacity so that you can do this and make things easier for you all. So just know that.
No other questions, comments? Well. Why?
Mhm.
Thank you.
Thank you.
All right.
Yeah, thank you
Thank you,
very
Jenna.
much.
Appreciate your time.
So do you want me to hop off, or do you want me to listen in? And if there's anything by the end, or does it matter? I'm happy to listen and stick around if you're okay with
Oh,
that.
that's fine. Yeah, we're fine with that.
Okay, great.
Okay. Were you gonna say something, or were you
No.
looking at me with, okay? Okay, so. She's given us a lot of tools that will be beneficial as we move forward. I think one of my questions that I have for all of you is, what do you see are the emergent issues? The things that really need to be addressed urgently? Because of the process, those are the things that you're gonna wanna look at first. And try to grapple with those topics, because we have to take it to council, recommend to them what your recommendation is. Then it has to be read, and then it has to be read again, and so there's some time in there in that. So if there's things that you really feel need to be dealt with urgently, we probably should look at those first.
You mean like one of our 3 ideas?
Was that something you want to hear right now?
If you have something that, yes, I would, if you have some things that you want to discuss that are urgent. Something for,
Yeah, I have a few things I think are urgent, and it mostly has to do with the homeless population that are addicted to substances. And as we know from being in Bangor, that's a huge issue for us. And I've been a proponent of a safe place, a safe injection site, as you know, and that's not a popular thing, but I do think that and that's where I am kind of on that. It's not only does it help the population that's homeless have a safe place to go, but it also exposes them to recovery, and would certainly help, in my opinion, help clean up the city with that. And I know there's some objection to that because a lot of it is certainly illegal. And so, you know, it's daring to say the least, but I see that as a horribly urgent issue right now. You know, summer's fleeting here, and it's gonna be winter again soon, and the Camp Hope is gone. So it's gonna be spread about. I know we're seeing, I see a lot in the park right by the library. You know, a lot of people are hanging there now, and and I get it, you know, I've been there too, so I do understand that. And so anyway, there's my urgent.
okay,
I agree with them. I know it's a weird stance for me to take, but we can't force people to stop using. They need to want to stop themselves, and having a place where they can safely do this. You don't know that someone that you're helping may say, okay, this is ridiculous. I need to get better. I'm gonna go take the steps to get better. We don't know when that's gonna happen. Like, for our boys, we didn't know. We didn't know when. I've talked to a lot of people, and they all said to me, you know, this is that and whatever, and I thought, you know, my boys were nowhere near wanting to get better. But places like that could feed them information and show them what recovery is and what, you know, is the same as Narcan. I think that's very important because they gave us 1 extra week with our son. And I wouldn't give that away for anything. I think someone can be Narcan, I know a guy that was Narcan 17 times. And on that 17th time, throughout the years, he said, I wanna get better now, and he is. So how do we stop? How can you just not help them get better? You see what I mean? If they wanna get better. It's true, you have to help them.
Yes.
I'm Jason Hunt. So I think in light of our recent HIV outbreak here in the Bangor area, that we and work that we're doing as collaboratively with many providers in the area, that we need to create a model of intensive case management for the people who have been recently diagnosed, and we know that there will be subsequent diagnoses because of how the epidemiology of this works. So, and that is not a long-term, that could be a 4-year funding stream, a funding commitment, but it doesn't have to be a 20-year, funding commitment at this point. So there's that intensive building a model that doesn't really exist anywhere, but using the expertise of the community here in the Bangor area to create a new case management model for people who are the hardest and most difficult to reach right now. We all are stressed. Everyone around this table is feeling the stress of what's going on in this community. And so making sure that we put another sort of resource that will help with that. I think what Scott said and what Shelley has talked about, as well as the safe use injection site. I just sat on a governor's committee that did a recommendation to the legislature about and created a really wonderful document. And it's actually not illegal. There is ambiguity in the law about whether safe use sites are actually allowed. Federally, there may be some questions. State, there may be some questions, but there's not. The Attorney General's office and other consultants have in that study, and that's something I'm willing to bring to the table for the next meetings, that there are copies of that, so you can see that.
Okay, great. Thank you.
I think the other big one is housing or some sort of Bangor-owned shelter system. And that how that's sustainable long-term, that's something we'd have to dive into, but using some of these, if it's allowable, and that's the other thing, I'd like to see those lists of what is allowable, and I would like to see the projection for Bangor specifically so that we can get an idea of what we're actually talking about here. So that would be great, but housing of some sort, whether it's a shelter system that is modeled after some of the other municipalities, either Portland or we can go to any New England community and see what they are doing, would be top priority. So,
Okay.
Thank you.
A local detox. So when someone wants help, they have a place to go right away, not have to wait. And it be local so that they still have their family support instead of having to go out of state, downstate, New England, some go to Florida, if that was a place people could go and get help right away.
I know we have
Do have one.
two right here in town,
One's in Hamden, right?
Right.
Yeah,
and the other is Wabanaki, so.
yeah, I mean, I wish there were more,
Yeah, yeah, I
Those
know,
weren't there when Adam and Sean died,
right,
and so that was one of the things I was like, geez, they had
Yeah.
nothing, so I'm glad there's 2, but I wish there was 12,
but I do know that we've been very successful at getting people in almost immediately into
Okay.
either detox. I
Yeah.
know that we were able to get somebody in there today
Yeah.
with just a
Okay.
few hours notice.
Thank you.
So I think that brings a good question, that there's definitely some education and communication and advertisement of the existing resources that may
Yeah.
need to be done. So that's, I think, a top
Mhm.
priority too.
Yeah,
Yep,
I am kind of thinking about the principles that I would like to see us apply to this funding. I think that we have a really awesome, unique opportunity to have a wonderful impact with this. And I see very often where funding is split into such small pieces that you can't have an impact with it. So I would like to see us consider ways that we can have a real nice, sustained, long-term income impact with this funding. From a prevention angle, some of the things that we see is that there are many families who are raising children that are not their own. In our own, like, small department, we have several examples of that at the health department even. Where people are in families that is happening. And many of those families struggle with supports and guidance, and the children struggle. I know that's happening also in the Bangor school system. And I would like to see some resources dedicated to supporting those families, with the idea that, you know, if we're addressing the needs of those kids, then hopefully at right now, hopefully we won't have to intervene with them later. Hopefully they will be, you know, nice, strong kids that are leading healthy lives.
I agree with that. I think that, it's become generational now. I believe too, you know, with the parents, grandparents even, it's generational. And so the prevention, this seems really complicated to me at this juncture.
When my son Adam died, he had two children and, the mom was also doing drugs, so we got the kids. And that was hard. They were little kids. We had to get up in the middle of the night and feed them. I'm like, holy, I already did this. I'm old, you know, I can't do this. And, I have not wanted to, but we decided that, we're gonna help the mom get better so that she can raise her own kids, but we'll be there for support. And thankfully that happened so that, less pressure on us and more being a mom, so.
How did you do that?
I'm always, she texts me with questions, I answer them truthfully. I'm that way, and, but there was a little bit of, coercion. Like, you know, if you keep this up, we're calling DHS and we'll have those kids again and you won't be able to be around them. And she quickly became, as she stopped using drugs, she quickly became wanting to raise her children. Like, she realizes now how much she missed while they were growing, that she wasn't available as a mom, so that kind of helped. I think there should be, I wrote here, programs for pre-K and to 12th grade. I mean, people are like, oh, we should hit them in middle school. You gotta get them, these kids are seeing this at home,
Mhm.
you know what I mean?
Yeah.
So I don't know, like home visits or guidance counselors more, I don't know.
It's complicated for sure.
It is, yeah. It wasn't easy getting her better, cause I didn't want her to. Oh, Lisa's got her hand
Yeah,
up.
she does. Lisa?
Yeah, I've heard some great suggestions. I think there's going to be so many opportunities here. I think I would just voice that my concern is, like, it was mentioned that anything that we look to do is going to be very time consuming. And I know that there's a lot of feeling that this money has been sitting, and what can we do to try and access it? So my hope is that we can try and come up with something utilizing the strengths in the community that we already have without necessarily reinventing a wheel, and trying to get something moving along. I'm sure it's going to take more than our first introductory session to get there, but I think that's
Yeah.
just my 2 cents.
Very true, thank you. Thought?
Well, to build on what Jamie said and what Lisa just said, I think we need to be sensible with our thoughts. Because this is not forever money.
Right.
So we're gonna have to develop a plan, and then what does it look like when the funding is no longer available? Is that now gonna be, is now the taxpayer expected to continue running the program that we have all decided is critical? Do we support programs that are already in place? Or do we develop a new program that may have funding for 8 years, but at the 9-year mark, who funds that program?
Mhm.
So I think we gotta be sensible about this. And Jamie's point is we can start big, but we may wanna look small and look at existing programs and who really is struggling for funding, but is doing great work. And maybe look
Sure.
there.
Thank you for that.
Give them a boost.
I don't know to add to that. I think that when the federal budget passes, this conversation could be completely different. I mean, so I just wanna put that out there.
After life
Mhm.
could be very different for sure.
Our organization is heavily funded through SAMHSA, and pretty much that entire organization is disappearing. Well, it is disappearing and it's going under the, um, that will have a major impact on all of the entities in this state that rely on SAMHSA funding for all of the work. So I think that's something to think about on how we can, as was said, how can we support those agencies that are doing the work right now? There's so many in this city that are doing great work. And, I think the city has been a great leader. Lately, things have turned around, I think, in a lot of directions about making sure that there's a plan for how some of this, continuing that so that the public health division in the city has some leads around that, and then also those organizations, without being a conflict of interest, at this point, but just like those organizations that are really the hospital systems as well, and how are we supporting that system that exists? So I thank you for bringing that up.
Yeah,
Mm.
it's a good idea.
I know for Fresh Start, the big part of the mission is that we're self-sustainable. And that's been very, very important. I think that's the crutch of this, the chief was saying, the self-sustainability. I don't think we should build something that's gonna collapse in 9 years. with the
Right,
money
right.
that's out, or be put upon the taxpayers, but we could certainly, there's a lot of things we could combine too, to make things better, I had looked, or Fresh Start had looked at, where Heal was. They had this heart center. And, we looked at that perhaps to do an overdose prevention center in that place where Wabanaki is right there too, and we're right up the street, that some of these combined efforts that would be self-sustaining, that could definitely be self-sustaining. I think would be great, and you're right, chief, it has to be. We need to watch what we're doing, and maybe it isn't some grand thing, maybe it is a whole bunch of getting together and.
Like boosting existing.
Yeah, make
Programs,
boosting
yeah.
existing so that they can expand into other areas,
Mhm.
I'm a little gun shy of expanding into, I prefer core, to stick with the core because I know the core works,
Yeah,
but perhaps with a partner. We can make it work, something along those lines, but.
I know one of the things that Jen Gunderman and the Public Health Division are working on, and they've, with us and other entities across the city, is to offer some expanded one-stop shop, especially in relation to the current HIV outbreak. So making sure that all of our entities have the capacity to have a doctor on site on occasion, on a regular basis, to do that prevention and education, to work with law enforcement to say, how can we support somebody that is chronically homeless and is shuffling around the city and doesn't, like getting them into the housing team or the path team or, all the options team, all those entities that are already doing such great work. And I put it out there that I think there is some really great momentum, and I think the city's public health division is a great entity to sort of lead some of that as well. So, but in thinking about sustainability, like making sure that there's a carve out that the city public health division has to continue to do the work that they are continuing to be doing, including returning to like their HIV, STD testing programs that haven't been as well funded in the last several years, being that connection for people, as well as how do we support Preble Street at the Hope House and PCHC and all those entities that are just hammering it every day, good work, and making sure that we have a mechanism that work can be recognized, because there is a lot of good work. We tend to see a lot of the negativity and but we don't often see the success stories that are happening every day. And so making sure that we celebrate that. That was a lot, sorry.
Well, no, that's fine.
That was good.
My brain.
There's a lot of information there, but this information that a lot of people don't know
Yeah,
that's out there.
yeah.
And we're gonna have to figure out how we're gonna find those groups that the chief was talking about that possibly could combine or that need the help to keep going. This doesn't mean there has to be one huge project. It can be. This is viewed as something that could help many.
Yeah.
And, we just want to get the most bang for our buck, just like anybody, but.
I think also one of the things that we've talked about, and Scott probably runs into this a lot too, is we know that people are, accessing detox, but then what, right? We have people that have never, may have never been stably housed in their entire lives, right? So they don't have the skills. We're seeing that in the groups that we're working with now. So putting them into a recovery home or putting them into an apartment with a voucher is not successful right now, because they've never had skills. No one's ever told them how to, maintain an apartment, or how to interact with a landlord, or, to pay the utility bill with the stipend that you may have gotten. It's not necessarily that the resource wasn't available, it's that they didn't know how to use the resource. And so again, back to that sort of case management model and it's not we're talking 24 people in this instance, and it may get a little, the caseload isn't huge, but those are the people that are really at the greatest need. And we are spending hours and hours and hours and, lots and lots of money to engage in that. And how can we do that better? Engage with those people and be more cost effective and be more community friendly. So that somebody can leave a center and go into one of Scott's homes and be successful.
I would echo that sentiment. I think I've got a perspective from a lot of different angles. I participated in a lot of these different programs. I've also worked for several of them. And I really think what we have is a bottleneck problem. We're missing a gap, right? So recovery happens when willingness meets opportunity. Somebody says, I'm willing to get clean. What can I do? Used to be you couldn't get into a detox. Now you can get into a detox, but you can't get into a rehab before you're booted out of the detox, right? We've got a housing problem. So we take people who are experiencing homelessness and put them into apartments with landlords who are, giving them a chance, but they don't know how to live in apartments. They get kicked out like that. Now they've got a recent eviction and are homeless again. We've got funding that's dwindling for our housing voucher programs. Used to be, if you had all the paperwork a couple of years ago, you could just get a voucher. Now there's a lottery for it. I used to work on PATH, so that's how I know all this stuff. So it's like, I would kind of, again, echo the sentiment everybody's saying. I think the money should be implemented in the programs that we already have to expand them to cover these gaps, instead of trying to implement something else in a way that they can build so that they can be sustainable.
Thank you. Lisa.
Well, Scott really kind of just said my thinking, but my wonder is we could do can we do something like a grant process, right? Like people would put in existing programs that would look to receive some of these fundings, and then we would be able to determine what a proposal would look like. Am I off base in my thoughts there? I guess I'd look to Jenna for that.
If I'm gathering what you said correctly, then yes, we could put together whatever it is that you wish for a process, and however, a grant, we have several templates. My one question would be, what's your existing, just as a quick thought, what's your need? What have you, I know there's like, the local, the county, the district needs assessments and data and all that. I think you all have expertise in your area. So I'm just kind of curious, are there some bodies or documents that you could refer to for numbers and to try to look at needs and gaps and that kind of a thing? Or is that something that you've already done? I'm just not exactly sure what exists for the city, and what, perhaps has been done already. That's just a question. I'm just wondering if there's a place to refer to information or.
East Public,
No
Great
idea.
question.
so East Public Health District, which Bangor is part of, I think Penobscot County is
Yeah.
its own public health
Yeah.
district. Maybe it's with Piscataqua, I can't.
With Piscataqua.
Yeah.
But there should be a community health improvement plan for that, for this public health district. We probably could take a peek at that to see what the public health district has identified as their highest priorities and see if that matches what we're feeling in Bangor at least,
Okay, so I'll tell you that in that plan is gonna be, things like, mental health, housing.
Very high
Um,
level.
Yeah, it's real high level. It's not, there's no like, nitty gritty inventory of services or, Jenna have other subdivisions done that, or do they have something, that could be, maybe there's something that's been done that we're just not quickly thinking about or identifying. Like I was thinking a little bit about, maybe the continuum of care application might have some housing related information in that, or like I could ask around at the health department. Or if someone else has done something like that, maybe it would be pretty easy to just pivot it and do a translation for Bangor.
Yeah.
And I do think it's gonna be really important to understand how much money we have first.
Yeah, I
And,
was.
and the cycle of how that's coming in, because I've seen it and it is, that's how we'll have to make decisions.
Yeah.
Yeah,
How much money is it? Do you know right now what there's in the bank account? I know it was just over $1 million, right? 1.3 million or something like
I
that.
was told today it's approximately 3 million.
3 million, okay.
3.45. I mean, I think I have it, but I didn't create it, so I'm not.
Yeah, well, this is,
Okay, so there's 3.45 million. And then so much a year coming in after that, that's on a scale that dwindles down, right?
yeah.
Something like that.
Oh,
So 2038.
to 2030.
It's,
Yeah.
I mean, so we should, if this is correct, we would have, 1.2 million already, or by the end of 2025.
Oh, okay, so actually in the bank
Oh,
is,
then
is the 1.2 million, right?
Yeah,
Oh.
and then, and I mean, it doesn't, if this is correct, I didn't create this, it's a little bit flatter through 2038 than I would have thought. It's not as dwindling,
Yeah,
Okay,
but
Could the city prepare us a table of that?
It's
Yeah.
all available. That's what I'm gonna send. That's what I was referring to, that I'm gonna send out.
you.
You actually, yeah, through 2026, you have to another 2025. I don't know that I'm not looking at the actuals, but you'll receive 200 and over 201,000, 2026, 214, and then it goes to 161, but then it go 161.7. And then 2028, it goes back up again to 229 something. So I'll send this along so you can see this and then look over time. Yours doesn't dwindle the same as some others do. And then it kind of does jump down a little bit more. But by the end, it looks a little over almost just under 3.5 million.
Now, are we deciding how to spend the money that's in the bank, or are we deciding on how to spend it through that entire period of time? Is that what this is?
It depends on what you come up with for
Okay,
projects
Yeah.
and ideas. I mean, if you're doing things, I'm hearing that some of the things you want to do are like urgently now, work on some things, get some things done. Some of the programs you were talking about, boost up some programs. Your larger projects, you would have to look at, the front end, how long it's gonna be to implement it. But
okay, so and for homework you've given us is to come up with our top three ideas, is that right, Susan?
if you think that was gonna be used for goals and looking at what you were all coming up with for ideas.
Got it.
Points of discussion, so we can start looking at. The idea that the chief brought up, that looking at helping existing programs, I mean,
Yeah.
those would be, we're gonna have to figure out what programs are out there that are doing really well, but that could use a boost to help continue what they're doing.
Yeah.
You mentioned some programs as well.
Yeah, and I think RFP, I think there probably could be some phases, like there could be immediate need, medium-term need and long-term need, and invest in investments in that. Two questions. One, if the city puts out an RFP, does the city have term limits on the length of that RFP? So could the city do a 10-year contract? Or does the city have to do a 2-year contract or a limited, is there a time limit on the length of a contract that the city can RFP out?
So,
Okay, and then, is this money allowed to be invested? Is there can this money be put into an investment source that can, like a trust or something that continues to earn money?
It's a good
I'd
question.
be interested if Jenna knows the answer to that question. I haven't dug into the program terms that deeply to know.
I would not be a big fan of hoarding money or, so, I think we have it, we should use it. We should use it, not try to get into the stock. I mean, I think that's what it's for.
this has been brought up multiple times by, the citizens, people we're representing. Why are we not using that money?
Yeah.
Um,
For its intended purpose. Yeah.
exactly. I
Yeah.
don't think they're expecting you to go out and come back with, after one meeting saying, okay, we're ready to spend it, and then spend it all.
Right.
But they haven't seen any movement, and I think they're concerned with that. They really would like to see something happening with that money.
One of the things that we'll have to consider is the cycle of that. So we have a chunk right now, right? And then we're getting 200 a year or something, right? So there's no way if we used all of the $3 million or whatever it is right now, I mean, we will have to figure out a way to spread that money out over a period of time. And one of the things that we could do is that if we did spread that money out over a period of time, and then we have the yearly accruing, we might be able to put that into some kind of investment account. I know that Oklahoma has done that with some of their tobacco settlement funding, and they've been pretty successful in that. I think it's worth looking into, because then we would have, we'd be able to fund stuff right now, and then as things come online, throw it. I work at the public health department. I am not a financial person. So, I think it's worth looking into,
So we need
because
to
I
look-
think we could still like, be meeting need right now
And
too.
it could be something like 2% of every year, right? The 2% of the allotment for every year gets invested, or, not suggesting that we do it, but I'm just saying that so that by, 2050, there may be,
We're still funding.
yeah, there's still
Yeah.
funding. If that's even allowable,
Yeah.
that's something that we, yeah.
We'll have to look
The
at
first
whether-
time I've actually heard that question, and I don't actually know the answer to it. Could I actually just suggest something that I'm not sure if you'd be interested in this, but I will say that we have numerous subdivisions who we've created a community profile for. And basically that we compiled information for access to any data. So it might include like your CHIPs and your community health improvement plans and your district. And then in addition to other data pieces that we might have or find, and then resources under the buckets. Saying, meaning when they say the buckets, the prevention, treatment, harm reduction, all that, and just kind of had it all in one place to look at. And I'm curious to know if that might be something that you all would be interested in, to have it compiled for you. I just heard someone say maybe we should get a list at like kind of what's happening. And that's something that we could do. We could kind of put it all together for you in one place. And if there's anything that we miss and you say, can you please add this? But we try our best to get as comprehensive as much as possible. Okay, Lisa, thanks.
Yeah.
Um,
And I think it's also important to show the public. I think that would be a great tool for us to have some transparency with the public, to be able to take it to city councilors, to be able to take it to representatives in our communities to say, here is what this community looks like and what we're dealing with. So I just think it's.
Yeah, you have to have that transparency with the people because they're already upset that they're not spending the money. So if you just keep them,
And if we could keep it simple
yeah,
too,
yeah,
let's not get so complicated that.
Yeah.
Well,
And I think a document like that will actually also show you if there's, wow, look at the strengths right here for the city. Wow, look at what we have here, but seem to be lacking a little bit here, and kind of an informal way to look at what's happening and gaps, I guess, really pretty high level and informally. So if you, I don't know if you have to vote or if you have consensus, if you want us to do that, the center would be happy to do that for the city.
I think it would be helpful.
Yes.
I agree.
It appears that there is consensus that they are interested in that, yes.
Okay, I'll put that, can get going on that.
And then maybe we can find out about what the money can be,
Yeah,
if it can be invested or not, or whatever. Cause I haven't heard that part either, so we're gonna have to get the answer to that.
yeah. I think we have a pretty lengthy sort of governing document
Yes.
that I can dig into and see if I can maybe pull out some high level guidance.
Mhm.
So that not everyone has to read those 30 pages.
That would be very beneficial, I'm sure. So we were. What's your pleasure?
Assignments for next time?
Yeah, thank you.
Assignments for next time. I think we need to, well, that's what we were starting to do when we got off on this document. You've talked a lot about bolstering programs that are already in existence. Maybe thinking about some of those programs and what it would look like, or picking one that you're fond of, and what would it look like? What are you recommending for how we could help it with this to keep going? You mentioned, or I think it was you, and you did too, maybe combining a couple of programs or partnering a couple. Now, certainly that's gonna have to be at the will of both of those two groups, and they're not able to do that, so.
I do think that could be done in an RFP process where you say,
Yeah.
we're gonna have an RFP for this amount of money.
Mhm.
And this RFP is specifically for agencies that want to partner, right?
Yeah.
And so you you build it so that that's what you get as a result, right? Like, so I think
That's a good idea.
there are ways that, so then, let's say Scott and I are looking at that and we say, oh, look, here's a chance for us to actually do something together in a meaningful way and have it supported, and then we would sit down and create the RFP and present it to, you know, I'm not saying that we would next, but like as an example, that's how that would, something like that would work, and, you know, maybe we get some creative ideas and around that. So there, I think there are a couple different kinds of RFPs.
Mhm.
Maybe there's, you know, more direct service, maybe there's more partnership, maybe there's housing, but there's some things that we can think about as we move through this, sort of maybe some categories that deal with things now and things, you know, in the future,
Or are we gonna do RFPs for all the money or,
or set asides for some, yeah.
okay, I see, yeah.
Was that the essence of what?
Yeah, I was thinking, I mean, there's obviously an impressive diversity of knowledge here, but I don't think that we know what every agency who is struggling, who needs.
Right.
That's
So
the thing.
I don't know if there was an intent to, I don't want to compare the two, because I know that there was some angst over the timeline on ARPA funding and how it was dispensed, and I realized that there's a desire to move much, much quicker in this instance, but there was a process.
Mhm.
And is that something that we're interested in, is a process, and I like
think
the
we need
idea
a
of it, yes.
process.
So if you have a program and you wanna partner with another agency,
Mhm.
are you gonna propose something to us?
Mhm.
And then we can determine whether or not, A, we can fund it, and B, is it something that we think as collectively as a group
Mhm.
that there's value in it?
Yeah, that makes total sense.
And then I
Thanks for
think,
keeping it simple. That's
Well,
perfect.
and I don't think all of it has to go for RFP. I think they're actually this is Jason's opinion and Jason's opinion only, right? Like that there should be a set, some for like the public health entity that governs the city, right? And so like I would propose that when we create a plan, that there would be a percentage that goes to back to specifically the city to manage in the way that the city sees fit, to create the programs and support the public health infrastructure that's here doing this work. And it's still money left over for all of the community organizations to access through RFPs or through some sort of process.
I have a question. Did every county get money? And then
Yes.
Bangor and
Yeah.
Portland, is that how
Yep.
it went?
Mhm.
So Penobscot, they're not gonna give Bangor money because they got money.
But I was
There are-
got the county, that's money.
There are
And-
39 subdivisions, so all 16 counties and then the additional 25 locations are any based on population and who submitted and litigated and whatever. So Bangor's an example because of the size, and Portland, but then we have small towns like Standish or and we have Callis that's getting funding. So it just is varied, and some of them went in on the lawsuit and some didn't. It just, I think at some point, I think probably most everyone was offered an opportunity and some signed on and some didn't.
So there's probably.
I don't know all the details of all that, but that's just my understanding.
So, but the county does have a lump of money too, Penobscot County.
Right, and Bangor is in Penobscot County, so I'm not sure, are they able
Two
to?
separate, two
Two
separate.
separate.
And then the
Okay.
county has its own process for disseminating their money.
Yeah.
So
Okay,
I know that some of the agencies in town have also received some of the county money, so that
okay.
might be a question that we ask in an RFP process, like, you know,
Have you already?
have you received
Yeah.
any ARPA money from another? And it could be part of, in the matrix of how we think about
Right.
the process.
We should
Penobscot
probably,
actually recently formed a committee too as well. Sorry to interrupt, but yeah, I think they recently formed a committee, and I think it all depends. If, just for example, if Bangor said, let's partner with Penobscot, and Penobscot wanted to partner, you all could. There's no exact way to do it. That's always I'm not saying that that's what you need to do. I'm just saying you could do that. Like, so there's no, just because they received money, they could give all their money to the city of Bangor if they wanted to. That's just based on how you all decide to spend the money. There's no exact way.
Yeah, but we could have a presentation from one of their board members to say, what are you doing?
I don't think they know yet. The other thing I would say is that I think it would be super foolhardy for us not to be communicating with them. Because if we both identify the same gaps in services and then we both try to apply the same gaps in services and leave other areas unaddressed because we weren't communicating, that would be silly. So.
It's very clear that there needs to be a process though, and that's gonna take a little bit of thought. So be thinking about that because you've heard, after the ARPA, getting all that in, and it was time consuming, and there was a lot of, questions about who was gonna review the things and all of that. This is a little bit different. I think you've got a committee here that could review, requests that were coming in for grant funding or proposals or whatever you want. But we have to have a proposal first to put it out. So we really need to dig into that, or, because each time, you know, there'll be a week and then we meet again. But that time's gonna go quickly, and people will get antsy about, how come we haven't heard anything?
Yeah, what are you doing?
How do I access the money? You know, who's gonna do this and that? So we can set those guidelines and have that ready to go.
Jenna, do you have access to, like other processes for RFPs that subdivisions have done?
I have access to the ones that, I mean, some of them have been put out to bid prior to our really starting, but we have basically who we've assisted with, as we could kind of just share that, and basically what we've created. You know, for example, Franklin County did a process, and then it didn't, they wanted to adjust their process, so we worked with them to make adjustments, and then we made an electronic application for them. And you know, so yeah, I think we can assist with what we know and what we've learned from other subdivisions so far, if that's what you mean.
Yeah, cause I think like things that come up for me are like, is it a multi-year, opportunity? If so, how many years? Like who reviews the outcomes every year, right? To make sure that the funding is being spent the way that, it was intended to be spent. What happens if people don't spend their money, right?
Yeah,
I mean,
I think all of those, yes, all those things are part of that's what the best practice way, right? And then you all get to decide, what do we want and how does the city want to operate? I don't know what the accountability format for the council, for how you are you making recommendations to the council, then the council's deciding? Like, I don't really know like your system, but if the city already has ways that they're monitoring and evaluating contracts that are in existence, that would probably play in a role in addition to what you all suggest. And maybe it's the committee reviews the things, maybe it's the city manager, or, I think that's part of what you get to decide. But we do have, there's variation by location, so to speak. So
This committee is here to make recommendations to the council.
to the council, okay.
A lot of the information that you just talked about that comes to your mind were part of the issues that were in the ARPA application as well. And we do have access to that. Super.
Yeah, they had a
So-
process where, I know you have to report every year,
Mhm.
where up to 5 years, what you've done with the money. If you've spent it all in 2 years, well, good, then it's accounted for with the city, then that's that. If it's an ongoing thing, like if you got a grant from the city for, something else, they monitor that over a 5-year period. In other words, there's some forgivable loans that the city has that they've done, and they monitor that over 5 years and report every year. Are you still doing your mission? How many people do you, for instance, with us, how many people are living in this house that we helped you purchase? Are they all still in recovery? Are you still using the property for that purpose? So they
Right.
do have processes
Built in.
for all that. Yep.
Okay.
Well, and Jamie, as you Oh, as you know, that's something that the Moss Center is, that's where one of our big body of expertise is, and that's what we really would like to be able to support you in, so that we can then look at impact and look at that sustainability of what's existing, how is it working, is it working how you expected it to work? So shorter term, or maybe having projects with check-ins, but having the way you write your contract in the language, if something isn't reaching certain goals or things like that, you could then choose to revamp or revise or the project. So I think that's all part of that like evaluation component that I would advocate to be part of whatever contract you decide for whoever that is, to look at how effectiveness and impact, and that's something that we for sure can help with, so that it can be easy, and any person that's funded, our goal is to make it accessible, and that's one of the examples of that we've shown for some others. We're trying to make it accessibly or easy to track whatever it is that they're doing, if they're funding a position or whatever it is, and then making that data accessible for those turnaround reports, and making that easy for the council to then receive something from all of its projects that it funds, or however. So
Awesome. Thanks, Jenna.
I'd like to think about that review process. I think, my concern is that we have several on this committee, several large providers of recovery services in this city right now, and I really want to be cautious and fair about conflict of interest. So I think like scoring, I think maybe we can create a scoring process or a review process that doesn't eliminate, you know, and really make sure that we are honoring conflict of interest process, and that we're not putting anybody in jeopardy.
That's another piece that needs to be done on the front end. Has got
Yeah,
that all ready to
exactly.
go,
Yeah,
because
yeah.
that became cumbersome with the ARPA applications, was the reviewing of it. But there were things in there also about what happens if they don't spend the money. All of those grants per se went out with, you need to start the project by X time. And if there was no movement, this would happen within the next period. And that wasn't very long, because we wanted them to use the money and get going, because we had to show that we had spent it. And
So
if
is
they
that
didn't,
something they
the
could
money came
provide?
back. The ARPA,
Yeah, I mean, could
The
we just look
application?
at that application
we can
and see?
get, well,
like,
we can get
yeah.
access to that.
In my prior role, prior to Wabanaki, I worked at the state and I managed contracts and I did a lot of RFP work.
Yep.
So happy to put that expertise to this committee as far as, you know, like
Yeah,
making
right.
sure that language and sort of making sure that those are built in. I think things like structuring, you might have a multi-year contract that you put out for bid, but it might be renewed based on certain markers every year. So like you might get funded yearly, but over a certain period of years. And if you don't make your goals in that first year, then you might not get renewed, you know? And so I think there are definitely mechanisms by which we can build into that process so that that are transparent and get reported on, you know.
Maybe we can get an ARPA application and we'll send it out to the committee.
Yeah.
We'll be looking at that, thinking about that for maybe next time to start drafting some guidelines and some of the issues that you were talking about. Because also at the next meeting, we will have the city solicitor and assistant city solicitor, or both, or one or the other, depending on their schedules, are coming to talk about the Code of Ethics and the Freedom of Access Act.
It
So,
might be prudent that we ask some of these questions when they're present. And I think the city already has guardrails in place
Yeah.
for a lot of these issues.
yeah,
And we're gonna be mandated to follow the city's procedures. So I think that
It will be
some of this is
helpful.
already, all of this has already been created.
oh, I'm
We just
sure.
need to be educated on it, and I think the city solicitor's office can.
They were on the meeting for tonight, but they had to be away at a conference, and that would have been kind of a hefty first start to have the Code of Ethics and Freedom of Access. So, but they will be here at the next meeting. And if we can have our ideas that you're thinking about for the process and the review and all of that, as chief states, I think you're gonna find a lot is already there.
Cool.
So,
Do you want me to include in my, all of the information I'm sending along, the, our RFP template series with budget and on all of our sample? Would that be helpful, or would that be too much? I certainly don't mind if you're gonna look at the ARPA stuff. I feel like, there might be some similarities, there might be some differences, or pieces you could pull from both, or, but if you want me to, I will. If you choose not to, that's fine too, just.
Are you talking about the main Recovery Council application, the grant application that they had? Because that was incredibly cumbersome.
No,
different.
they're independent of us. They had their own process. That's not us. So, we created something, that was, we
No,
have
What is that?
we have a couple different
And I thought that
variations.
was an easy one.
You did?
Yes. It wasn't.
do we want to talk to the solicitor?
I think,
first?
I
And
think
you'll-
finding out what the city has in place for their RFP process and if there's gaps that we
Then
could
we
fill
can
in with some of the
fill
other,
it in
and where our
with maybe
wiggle room
what
is,
they've
because,
got.
yeah,
Sure.
yeah. But it doesn't hurt to see it. It just doesn't,
No.
I wanna hear what the city solicitor has to say first.
Yeah,
Yeah, and I think the benefit of
Yeah, go ahead.
the benefit of operating within existing systems is that you can sort of incorporate this work there and not have to spend some of these resources on people to administer the programs, because we already have the
Exactly.
infrastructure to do that.
you don't want to reinvent the wheel if we
Right.
don't have to. So. I think that would probably suffice for your homework, as you said, would be to think about just the
Process,
application
yeah.
process
Yep.
and the guidelines that we want in there. And we'll go over that while we have the solicitor here.
So you say we have to figure this out by the end of December? Is that the idea?
Figure it out by the end of the summer,
December
December.
or earlier?
The committee has been formed to work through the end of December.
Okay.
That it can be extended if we needed to. They're not saying that we have to have it done, but I think that's just giving us time. If we're meeting twice a month, that will help. Get
That should give
through,
us time.
I think so.
Yeah, it makes sense.
But if we get to the end and we need 2 more meetings, I'm sure we can get 2 more meetings.
I think there's a lot of people that would love to see us have it done by the end of the summer.
Yeah,
I think
I'm
that's-
sure.
Yeah,
You're
I
right.
think getting the request RFP out faster,
Yeah.
will get it done quicker.
yeah.
So,
Well, getting that RFP out would have helped a lot in the APRA process.
Yeah.
So that's a lesson learned, is that we really need to move on that. We're gonna work on this.
Perfect.
So. Closing thoughts. I think we've pretty much covered a lot. We've covered a lot of ground, a lot of thoughts. We've got a plan for what's gonna happen, what we're gonna bring back for next week. Is there anything we're missing? And we'll just go around the room. Shelley?
I don't think so. I think we have a plan.
Okay,
Oh, good, thank you.
okay,
Okay.
I'm good.
Same.
Good?
Lisa?
I'm good.
All right, well, Jenna, thank you for attending and giving us your presentation. And thank you all. We will resume on the 9th at 6 o'clock in this room, unless we remarkably get to our new home. Won't be there yet. Not yet.
Trying awfully hard, aren't you?
Yes.
Yeah, thank you.
Thanks,
Jenna.
Jen.
Thank you, Jenna.
Thank you
That
all.
was good.
We are adjourned.
Thank you.
Now I figure out how to adjourn us.